union leaders to petition the Efcc, Icpc over alleged corrupt practices in health ministry. Corruption allegation has enveloped the Federal Ministry of Health. Union leaders are said to have uncovered wholesome practices in the ministry. The actions are said be in violation of existing public service rules. A report by Daily Post indicates that a wanton disregard of public service rules and government directives have been going on courtesy of some of the newly appointed chief executives officers under the Ministry of Health. According to the report, some of the CEOs have undertaken wholesale promotion and demotion of staff in their establishments, in open violations of existing public service rules and disrespect to the leadership of the Ministry of Health. Sources quoted in the report allege that the CEOs of both the National Health Insurance Scheme (NHIS) and the National Primary Healthcare Development Agency (NPHCDA) have been unilaterally removing duly appointed general managers, directors and heads of departments. Those removed are being replaced with junior officers, contrary to public service rules and tenure policy of the federal government, as it relates to directors and permanent secretaries. Minister of Health, Professor Icpc has been accused of failing to call the indicted CEOs to order. NAGE.com gathered that the officers affected had not been indicted of any misconduct before they were relieved of their duties. The actions of these new chief executives have created institutional confusion and infighting within the agencies at a time when the ministry and its parasitals are expected to be busy working on how to implement President Buhari's change agenda, a source quoted in the report said. Meanwhile, there are concerns over the reluctance of the Minister of Health to effectively supervise the new chief executives. Some members of the National Assembly are said to be furious over the ongoing development, because according to them, the actions of the CEOs will give the government a bad name. A member of the Senate Committee on Health who spoke on the condition of anonymity, said the Senate has been inundated with petitions drawing attention to the high-handedness of the CEOs. The senator wondered why the ministry had been unable to resolve the problem, even as he hinted that the Senate may soon launch an investigation into the situation. Also at the House of Representatives, members had unanimously agreed to investigate corrupt practices at the NHIS, with a resolution to amend the act establishing it. The lawmakers also contemplated suspending the scheme, to redirect it amend the act, to reflect its original goal. NAGE.com also gathered that trade union organizations within the agencies are poised for a showdown with the CEOs over their actions. Leaders of the unions are said to have resolved to forward petitions to the Economic and Financial Crimes Commission, Efcc, and the Independent Corrupt Practices and Related Offenses Commission, Icpc, to probe the matter. They alleged that the chief executives must have been acting in collusion with the Minister of Health. Efcc boss Ibrahim Magu and his team might need to beam their searchlight on agencies under the Ministry of Health. When contacted, the spokesman of NPHCDA, Saidou Salah, dismissed the allegation, saying it is unfounded. He said, "The new CEO is only repositioning the organization in line with the mandate given to him by the president, for efficiency and meeting the needs of Nigerians. It is only upgrade that happened and the movement does not affect seniority in NPHCDA and not a demotion as alleged by your source," the spokesman said. He added that the development at the agency does not contravene the public service rules. On her part, the director of press at the Ministry of Health, Mrs. Abode Kinola said, "I am not aware of such so I need to get a brief from my principal. I will talk to the relevant officers and let you have my findings, she said. Efforts to get officials of NIS to speak on the matter proved abortive as at the time this article was published. Meanwhile, the Nigerian Senate has received massive commendations from Nigerians over a recent motion the Red Chamber adopted. The motion seeks to compel hospitals to treat and provide medical care to gunshot victims without necessarily obtaining a police report.